Cervicothoracic sign. Remember, normally the upper part of the anterior mediastinum is at lower level than the posterior mediastinum. Therefore, and the landmark for this is the clavicle. Therefore, if a lesion appears above the level of clavicle, then it should be in posterior mediastinum because the upper part of the anterior mediastinum is lower. Now, if a lesion ends at or below the level of the clavicle, then it is in anterior mediastinum. And if the lesion goes above the level of clavicle, then it will be in the posterior mediastinum. One note we should always take into consideration before applying cervicothoracic lesion is we have to check for thyroid lesion or the neck lesion. Therefore, if the superior continuity of the lesion is not well defined, means it is continuing towards the neck, then it would have been a thyroid lesion. Let's draw the diagram. First draw the trachea, the lung, right color clavicle and lesion. Since lesion is below the clavicle, it is in the anterior mediastinum. Similar, again we'll draw clavicle. Now you can see the upper part of the lesion is well defined and it is above the clavicle. Therefore, it is in posterior mediastinum. Let's see the radiographic image. On the X-ray, we'll draw the lesion. It is above the clavicle. Therefore, it is in posterior mediastinum. On lateral chest X-ray also we can see. On CT also we can see that the lesion is near the vertebra. Therefore, in the posterior mediastinum, we'll remove it and then see. The thoracoabdominal sign. It says that whether a lesion is in the thorax or abdomen. If there is convergence of the lower lateral margin towards the spine, then it is an intrathoracic lesion. The reverse way, that if there is a divergence, then it is an abdominal lesion. Also, if there is silhouette sign with the diaphragm, then the lesion is at the diaphragm or it may extend below it. Let's draw the diagram. First we'll draw the vertebra, then we'll draw the lungs. Now we'll draw the lesion. First we'll draw again the vertebra and the lungs. See, the lesion is converging towards the vertebra. Therefore, it is an intrathoracic lesion. Let's see in the radiographic image. The image here on the black line, the lesion is converging towards. Therefore, it is an intrathoracic lesion. These are the lymph nodes. Therefore, thoracoabdominal sign. If the lesion is converging toward the spine, it is an intrathoracic lesion. Hilum overlay sign. There are two aspects of this hilum overlay sign and any of them can be right. First aspect is if the hilum is lateral to the lateral border of the mass, then it is due to cardiac enlargement. You can imagine that if the heart will enlarge, it will push the hilum laterally. Therefore, the lesion is cardiac lesion if the hilum is lateral to the lateral border of the mass, and the lesion can be mass if the hilum is medial to the lateral border of the mass. The second aspect is that if the mass is silhouetting the hilum, we'll study silhouetting in detail, but remember that if the mass is silhouetting the hilum, then it is in contact with the hilum. Or if the mass is seen separately from the hilum, that means the hilar vessels can be seen through the mass, then the mass is either anterior or posterior to the hilum, that is either in the anterior or in the posterior mediastinum. Let's draw the diagram. We'll draw the first aspect. If the hilum here is medial to the mass, therefore it is not cardiac enlargement. Let's draw the other image. Now this mass, the hilum is lateral to the lateral border of the mass. Therefore this lesion is cardiac lesion. Let us see the second aspect. As you can see, the hilar vessels are seen in the mass. We can also see through the yellow arrows. Therefore, the lesion is either in anterior mediastinum or posterior. You all see how to identify the second aspect. See the labeling. The hilar vessels are seen through the mass. Therefore, it is either in the anterior or posterior mediastinum. Hilum convergence sign. It is seen when there is enlarged hilum, means the hilum is enlarged on chest X-ray. Then we use hilum convergence sign to find out the cause. If the vessels converge directly to the hilar shadow, then the cause is vascular. If the vessel converge medially to the hilar shadow, the cause of the diagram, first we'll draw the trachea, then we'll draw the lungs, then we have drawn the hilar mass, the enlarged hilum. Now the vessels are converging towards the mass. Therefore, this cause of enlarged hilum is vascular. This vessel is converging medial to the mass. Therefore, the cause is a mass or a tumor. In the image, here we can see the enlarged mass and the vessels are converging towards it. Therefore, this is vascular cause, that is enlarged pulmonary artery. Silhouette sign. What is silhouette sign? If two structures will have same density and they are in the same plane with contact with each other, then the interface between the two structures is obliterated or vanished. This is silhouette sign. Now how will you say this? You have to always say that there is loss of silhouette or silhouette sign positive. In the diagram where we will find silhouette sign, first we have drawn the heart and the lungs. Now near the right heart border, near the diaphragms, then the left heart border and the upper border, we will find silhouette sign. If near the right heart border, then right middle lobe is near the right heart border. Therefore, pathology is suspected of right middle lobe. Diaphragm, right lower lobe. Left diaphragm, left lower lobe. Left heart border, the lingular segment is in contact. Therefore, pathology is suspected of lingular lobe. And the upper part of the aortic knuckle is the apico-posterior segment. Of left upper lobe. Let us see with the X-ray image and understand the silhouette sign. As you can see in the chest X-ray, the green part which is highlighted is the pathology. It is near the right heart border. Since the two structures are in the same plane and in contact with each other with the same density, the border between them is obliterated. Therefore, if you can see in the image on your left side, the right heart border is not seen. Therefore, if a pathology is seen and the right heart is obliterated, we have to suspect that the right middle lobe is pathological. And take another example. Here we can see the pathology is in green highlighted. This is near the left heart border. Now both the structures are in contact with each other and therefore the density is also same. Therefore left heart border is not seen. Therefore, if the left heart border is not seen and there is a pathology near the left heart border, we can use Silhouette sign to locate that this pathology is of the lingular lobe and the diagnosis of lingular lobe middle. Now again, if we use silhouette sign, the left diaphragm is not seen and we have a pathology near it. Therefore, by using silhouette sign, the left diaphragm is not outlined. Therefore, it is near the left lower lobe. Therefore, this pathology is near the left lower lobe by silhouette sign. Now let us revise the signs in respiratory system. First was cervicothoracic sign. The posterior mediastinum is above than the anterior mediastinum. Therefore, if the lesion is above the level of the clavicle, then it is in the posterior mediastinum. We have to note that we have to rule out thyroid lesion and then apply this cervicothoracic sign. Second sign was hilum overlay sign. If the hilum is lateral to the hilar mass, then it is a cardiac enlargement because heart has enlarged and pushed the hilum laterally. If the hilum is medial to the mass, then it is a mediastinal mass. The second part of the hilum overlay was if the mass is silhouette in the hilum, then it is in contact with the hilum. Means what? If you can see hilar vessel passing through the mass, then it is either anterior or posterior. Because if it was in the hilum, then because of the silhouette sign, the vessel would have been obliterated. Since the vessel is also seen, then it is either anterior or posterior. Third one was hilum convergence signs. What is hilum convergence sign? If the vessel converge towards the enlarged hilar mass, then that enlarged hilar mass is vascular in origin. If it converges medial to the enlarged hilar mass, then it is a mass or a tumor of the hilum. Silhouette sign. What is silhouette sign? Silhouette sign means if two structures having same density are in the same plane with contact with each other, then the border separating both of them will be obliterated or vanished. This is used to identify the site of the lesion. If it is near the right heart, then the pathology is in the right middle lobe. If it is in the right diaphragm, right lower lobe, left diaphragm, left lower lobe, left heart border, lingula, or if it is in the upper part of the aortic knuckle, then it is the apito-posterior segment of the left upper lobe.